we welcome Dr. Martin Gardner back to the program, and Dr. Gardner is with Waitaha Primary Health. Very good afternoon to you, Dr. Gardner.
Yeah, g'day.
G'day. Hey, for those that don't know, what is Waitaha Primary Health?
Waitaha Primary Health is a PHO, or primary health organisation, which is any number of them around the country, and they sort of act as a management stream between general practices and the Ministry of Health.
Okay, thanks for explaining that. And Dr. Gardner, you specifically, we're talking COVID-19 in North Canterbury here today. How are we looking overall here in North Canterbury? We're into level 3. Are we, obeying the rules, and are we going okay?
Well, I think generally, yes, we are. Obviously, having no new cases in the last couple of days is an amazing result. There certainly have been cases in North Canterbury, but they've all been very well managed and contact traced and more or less stamped out. So, the results are looking very good. I would just caution everyone to, because of the great results we've had, we don't want to get a little bit too blasé too quickly, and just to reinforce the importance of social distancing.
Absolutely. Can I ask you, though, if this continues on a no-case daily basis for the next 2 weeks or so, does that mean we've beaten it?
I think we could be quietly optimistic that we're on the way to beating it, but 2 more weeks of no cases, it wouldn't quite be enough. We'd need to be going for longer with no cases, and we would need to increase our testing dramatically to be sure that there were no new cases.
Okay, so we're by no means out of the woods yet.
Oh, no.
If somebody in North Canterbury wakes up in the middle of the night tonight and is not feeling well, flu-like symptoms perhaps, what would you advise them to do? To think, well, I think I might have the flu, or should they in fact go and get themselves tested?
Well, I think if they think they've got the flu, then they should get themselves tested. I think we really want to be testing anybody with any flu-like symptoms at all, and so there are a couple of ways of doing that, either by your GP or by a Healthline and arrange a test.
Okay, where in North Canterbury can we be tested?
So the same as last time, there's still a little testing centre in Amberley, next to the Amberley Medical Centre, and then a bigger one is on Coldstream Road, next to in the hockey turf building in Rangiora.
Okay. Dr. Gardner, should we still be wearing masks and, maybe, disposable rubber gloves, that sort of thing?
Well, I think it comes down to personal preference. I think if you're going to be in close contact with people because of your work, then you might want to wear them. Just down to the supermarket, I don't think it's necessary, but it's whatever people feel comfortable with, I believe.
Yeah, with you. As regards children, can children, as far as you know, transmit the virus?
Well, anyone can transmit it. Anyone that's infected can transmit it, and children seem to get a milder form of the illness, and or maybe have no symptoms at all. And adults too can do that, but it is a bit more likely in children. So yes, they can transmit it. Okay,
but often with children, the symptoms seem to appear to be more mild than adults. Is that right?
As a general rule, yes.
Yep, okay. But don't be fooled. If a child has mild symptoms, that means that they can transmit. In your opinion, do you think we are going to see a vaccine for COVID-19 anytime soon?
Depends how you define any time soon, but certainly I wouldn't have thought there will be one by the end of this year. There won't be one by the end of this year, but certainly getting into next year, we would be hopeful, yes. All
right, well, that's reasonably encouraging. Mind you, we've got a long way to go this year, but I was hoping you were going to say, yep, I think that could happen any month soon, but no, unfortunately not. Well, anyway...
No, I don't think so.
Yeah. Dr. Gardner, thank you as usual for your time. Dr. Gardner, everybody, from Waitaha Primary Health, Dr. Martin Gardner, Compass FM.